Hello friends, I'm Dr. Amit Goel, Senior Consultant Urology, Uro-Oncology and Kidney Transplant Surgery. Kidney stones and ureteric stones are very common problem that we see in India as well as other parts of the world. Let's discuss something about the kidney stones. I'll tell you something about the kidney stones. So how the kidney stone forms first of all. So the kidney stones are a solid piece of material which are formed due to the deposition of crystals in the kidney, which keeps increasing in size gradually, and then they try to pass down from the kidney to the ureter, and in course of this it causes pain. The stones can be found in kidney or in the pipe that connects the kidney to the bladder, that means the ureter, or in the bladder. Now, what are the symptoms that we see in the patients of kidney stones and the ureteric stones? Kidney stones may get big without causing any symptoms at all, and we might find big stones that are lying in the kidney with patients having no complaints at all. But the usual complaint of the patient is dull pain that the patient feels in the flank region, and sometimes we do find very severe pain also, but usually it presents with dull pain and sometimes blood in urine. Now we come to the ureteric stones. Ureteric stones, when they try to pass through the ureter, the kidney stones, when they form and then they try to pass through the ureter, in this course they obstruct the ureter, and because of the obstruction of the ureter, there's a flow of the urine gets obstructed, and because of that the patient starts feeling a lot of pain. This pain is usually very severe, and the patient tosses in bed because of the severity of pain. And the pain is typically, it starts in the loin region or the flank region here, and then it goes down through the tummy to the genitals of the patient. This might be sometimes associated with nausea or vomiting. The patients might complain of difficulty in passing urine, or there might be burning in urine, there might be blood that the patient is having in urine, or there might be fever associated with these symptoms. Regarding the bladder stones usually they cause burning in urine or sometimes blood in urine. Now, how do we diagnose the stones in the kidney or in the ureter? The initial diagnosis and initial assessment is usually done by the ultrasonography of the kidney, ureter and bladder region. But if I talk about the gold standard, plain CT scan of the KUB region, that means the kidney, ureter and the bladder, is the best investigations for the kidney or the stones in the ureter. Coming to the treatment, small ureteric stones, like if they are less than 5 millimeter in size, these are the stones which, when fall down into the ureter, these are the stones which might pass on their own, though they give you pain, but with the medicines and all, these stones usually the patient pass off. So we usually treat these patients with painkillers as medicines, and some medicines which help the patient pass the stone in the urine. But having said that, it is not mandatory that all the patients who are having stones less than 5 millimeters in size, they will pass off on their own. There are certain group of patients like who are having single kidneys, or who are having kidney failure, or they have some infection in the kidney, that means a very high grade fever, or some infection focus is there in the kidney. Then these are the patients which we need to address surgically. Another modality of treatment is ESWL, that means extracorporeal shockwave lithotripsy, in which if there are small stones in the kidney and in the upper ureter part, we give them shock waves from outside the body, and the stones are broken into small pieces, and then they pass off into the urine. Then we have percutaneous nephrolithotomy, that means PCNL, and in this we make a very small hole in the backside of the patient, directly into the kidney system, and the stones are visualized, and these stones are broken into small pieces, and these are taken out from the small hole that is made in the patient's back. There is the latest modality of treatment that we have is retrograde intrarenal surgery, that means RIRS, in which we use laser and a flexible telescope that we pass on into the patient's kidney from the urethra up till the kidney, and then we use laser to fragment the stones, and this stone eventually comes out of the patient's body. This is no cut surgery. There's no scar, there's no cut that the patient has, and the recovery of the patient is just in 1 or 2 days time, and the hospital stay is also just for 1 day. Now, coming to what forms the kidney stones. Kidney stones are mainly made by the calcium oxalate. Some stones also have uric acid, and there are infectious stones also that we call as struvite stones. What are the risk factors for formation of kidney stones? Dehydration is the most common risk factor, followed by high intake of protein. If there is a low intake of fluids or warm climate, that is also one of the predisposing factors for formation of stones. Genetic predisposition, that means if there is a family history of kidney stones or metabolic diseases in the patient. Obesity and sedentary lifestyles are other risk factors for formation of kidney stones. Now, what can we do to prevent the formation of kidney stones? Any patient who is having a kidney stone in his lifetime has a 50% probability of having the stone again within a span of 5 to 10 years. So these are the patients who should be on a lookout, and they should be regularly getting themselves on a yearly basis for any formation of silent kidney stones. But we can definitely do some things to prevent the reformation of stone. The first and foremost is drinking plenty of fluids in any form. Then avoiding excess of animal proteins in the form of meat, restricting salt or sugar intake, regularly exercising and controlling the weight. We can also prevent the formation of stones that are formed by the calcium oxalate, by avoiding oxalate-rich food like cashew nuts, chocolates, pumpkin, palak, grapes, chiku. There's a long list of oxalate-rich food which we can avoid. Now, what we should intake for prevention of these stones is basically citrus fruits, coconut water, carrots, karela, that means the bitter gourd, bananas, watermelon, barley, oats, legumes, and these are some of the good foods that the patient should take to avoid reformation of the stones. And then once the patient comes to us, and if we find that the patient has got a tendency to form the stones again and again, these are the patients once the operation is done, we do a whole metabolic workup in the patient to find out what is the cause of these recurrent stones, and these can be addressed too in these patients. Thank you.